St George's University Hospital's NHS Foundation Trust, to give it its full name, is one of the largest healthcare providers in the UK. A team was in Gibraltar today to sign their contract with the health authority, securing expertise and cutting-edge resources for local professionals and health service users.
You don't do it because it's a manifesto commitment. It's a manifesto commitment because it's important to do. And we have this commitment to strike a partnership with a major UK healthcare provider, and I think we've hit possibly on the best one to suit our needs. It's one that is in London and is very large, a whole range of services and facilities, and we feel that it's going to improve the quality of healthcare that we're able to provide to our community, and also, because of the increase in contact, actually improve the level of healthcare that we deliver in Gibraltar itself.
Well, we're delighted to have the opportunity to work with colleagues here in Gibraltar. We've signed a very wide-ranging agreement that enables us to support the health services here in Gibraltar across really pretty much any clinical specialty you might imagine, but also for us to work with the doctors and nurses here to support their training and development.
We have had specialists coming over, for example, to help with our colon cancer screening. Also for neurology, we've had some multiple sclerosis specialists coming over and holding a very successful clinic. So that's already happening. We will have more visiting consultants coming over. We will have, for example, a second opinion radiology service, which I think is very, very important. And there will also be a centre of preference for referral to our sponsored patients who need to have treatment outside Gibraltar in the UK.
We think that this agreement enables us to ensure that patients get access to exactly the right treatment in the best possible location for them. In most instances, the best location for patients is actually as close to their home as possible. So that's why we've got people from St George's coming out here to see patients themselves, and also to support the GHA staff seeing their patients. But there will be some patients who do need to travel to London, and by having a relationship with a comprehensive hospital like St George's, then those patients, they can come to London and they can see whatever range of specialists they need when they arrive. St George's is one of England's oldest hospitals, founded in 1733, and has had a really strong reputation over the years for providing innovation and best quality of care. We have all of the services that you need in a specialist hospital all on one site.
And I suppose the basic sort of idea underpinning this agreement that you've entered into and formalised today is that the hospital is a large organisation, but you can't pretend to have every single expertise covered, and therefore it is important to bring in outside experts.
Absolutely. Well, but even if we have the expertise, having people you can talk to at the end of a phone, at the end of an email, for second opinions, for advice, for discussion of complex cases is always going to be beneficial. But also, a place the size of Gibraltar, in some areas, will never have enough cases to not just to warrant having the personnel, but also for personnel who we might have to keep their skills. So we need to rely on other centres, and I think we've hit on the right one, and I'm very much looking forward to continuing the close work we've had with St George's over the last year or so.
The colleagues that have come out in the advance party, if you like, we've already seen some patients here. They've been given a fantastically warm welcome by the staff and the patients in Gibraltar. I know I've got a whole cohort of people back in London who are very, very excited about the opportunity of working with colleagues here, and we hope that this is going to be a long-standing arrangement that will develop over many years.
Dr. Cortes says the GHA will continue to use services from other hospitals as well, including the Royal Marsden and Great Ormond Street. He also confirmed the contract would be financed by reallocating existing funds.